Okay, let me call my grandma really quick and let her know we're leaving.
I'm so excited that we're gonna go to your grandmother's to go like rafting and mountain biking. I've never been to the mountains.
You're right.
It's fun.
We are leaving right now. Me and Veronica and Courtney are going to be there in like 5 hours, so we will see you soon, okay? All right, well, we'll see you later. Bye.
So Heather, you have directions. I mean, you know how to get to grandma's,
Yes,
right?
I've been there millions of times. I know how to get there.
Okay.
It's not rocket science.
I just don't want to get lost. All right, okay.
Just hop on the highway and it's a straight shot.
Straight shot. We're going.
We're good.
Heather, we've been driving for 7 hours. Are you sure you know where we're going?
No.
You don't know? Okay, well, I mean, I don't have GPS. I don't know. Should we pull over?
Probably.
Okay. Well, let's get out. I don't know. Should we get out?
We should probably try and find some, walk.
Let's
See
find
where we
some
can
help.
go.
Let's go find some help?
Yeah.
Okay, let's go get some help.
Okay.
But it's cold outside, you guys.
Well, it's fine. We'll
go
it's
really
right down
fast.
the road.
I know, but we're not prepared. Like, we're going to lose a lot of heat.
We'll be okay. We'll be okay.
All
We'll be
right.
okay.
This is a very common situation. Just as you saw with Veronica and Heather, they thought they were going to West Palm Beach, but they ended up in Maine. They did not have the clothes they needed, and their bodies in the cold were going to lose excessive amounts of heat. In this next scene, we will show you what exactly to do and how to be prepared for a situation like this.
Oh, it's really cold out here, guys.
I know. I hope we can find some help.
Okay,
Are you okay? It's so cold.
Give me your
Oh my
backpack.
God, are you shivering? This is a good sign actually because at least her body's trying to generate some heat. But you're so cool to the touch. Well, let's walk a little bit more.
I think she's getting too sick. We should probably let that. Wait a second. My mom told me to always carry a Mylar blanket.
Yeah, okay, let's lay you down. Oh wait, her muscles are really, really stiff. Okay, let's try and lay you down. Okay. In her hand,
Right?
she's turning blue. Oh my God.
We just gotta keep her warm and then we'll get help.
We're gonna keep you warm. Okay, but never cover the face because that's not good. All right, honey, we're gonna get some help, okay?
Heather, Veronica, and Courtney have found themselves in a very sticky situation. According to the American Heart Association, there are 4 signs of low body temperature. The victim's skin is cool to the touch, the victim is shivering, the victim will experience a change in personality, they may become confused, sleepy, or even have slurred speech. The skin will become ice cold and blue, and the muscles will become stiff and rigid. If the body temperature continues to drop, the victim may suffer from these common signs. The victim's breathing slows down to the point it is difficult to identify if the person is breathing or not. The victim stops responding, and the victim enters into a coma or even appears dead. The most common cause of death is prolonged exposure to cold air, cold water, or cold, damp condition. When the temperature falls below 95 degrees Fahrenheit, this signals the onset of hypothermia, which Courtney so vividly portrayed. The hypothalamus controls the body's temperature and identifies when the body temperature is changing and how to respond appropriately. When too much heat loss is expressed, the body will begin to shiver in an attempt to generate more heat. When heat loss is greater than the body's ability to produce heat, the body's core temperature will drastically fall. When this occurs, the body will direct blood to the vital organs such as the heart, brain, kidneys, and lungs.
Courtney, honey, are you okay?
Yeah.
Okay, stay with us, okay? We're gonna try and keep you warm. Oh my God, thank you. I'm so glad you're here. Do you have a cell phone?
Yeah, I do.
Please call 911. Our friend has hypothermia, at least we think so. We need to get an ambulance here.
Okay, 911.
Yeah, tell them that our friend, we think she has hypothermia.
In this situation, Courtney did not need CPR. Had she stopped breathing, however, she would have needed 30 compressions every 2 breaths. Thankfully, the ambulance got there, and she is good to go.
I'm so glad the ambulance came. I'm so glad Courtney's getting taken care of. But, you know, my hands are cold. Like,
They're starting to turn white and they kind of feel weird. Like
Yeah.
waxy. You might be getting frostbite because now they're turning blue.
Oh my God.
Had Veronica had any rings on her fingers, it would have been very important for her to remove those before the treatment of her frostbite began.
We need to get you to the hospital soon. Hopefully they get us there because you need to stay warm, but we can't rub it or do anything that would irritate it.
Are they going to cut my fingers off?
No, they'll be fine.
Okay.
We have to warm them up slowly. We can't use any heating pads or anything like that. We just have to let them warm with the temperature.
It is very important not to massage the area that has been frostbitten or to try and heat it with a heating pad, stove, or fire, because by the time that your hands have been frostbitten, you can't feel anything, so it's really important that you don't burn your appendage.
Are you okay? Are you okay? You look really sweaty. Let's get to a cool place. Does anybody have a wet towel? Thank you. Here, here's some water. Are you feeling a little cooler?
Yeah. I feel a lot better. Not as dizzy anymore.
Okay, we're just gonna monitor her, make sure she doesn't pass out.
An early indicator that the body's cooling system is becoming overwhelmed is that your skin will become pale, ashen, moist, and cool. You also may experience a headache, nausea, dizziness, or even weakness. These are all signs of heat exhaustion.
Oh no, her skin's kind of dry now. Oh, I think she's having a heat stroke. Here, lay down. I'm gonna lay her on her side. And where's the ice packs? Put an ice pack on her neck. Put ice pack under her arm. Oh, a soda. What?
You can't have
I want
caffeine
it.
or alcohol when you're dehydrated.
Okay.
Replenish fluids. Drink lots of water.
Symptoms of dehydration include dry mouth, thirst, sleepiness, drowsiness, weakness, headache, and less urine output. The most important thing to prevent dehydration, however, is to stay hydrated with cool water.
This is our first aid kit. In it we have eye dressing, first aid burn cream, and root beer for a diabetic.
Well, we also have an instant cold pack. We have first aid cream for minor burns and scrapes. We have 2 types of bandages, knuckles and the flexible adhesive kind.
We have an antiseptic spray, a mylar blanket, gloves, and gauze pads.
We have a self-adherent bandage, and a rescue mask to prevent bloodborne pathogens, and an AED.
This is a training device only. No shot will be delivered.